Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner and also a nurse educator. In today's video, I'll be going over 5 mental health NCLEX questions courtesy of nursing.com. Nursing.com is an excellent resource if you are in nursing school. They have courses, cheat sheets, practice questions, study plans, sim clocks, have videos, and their courses and videos can guide you through nursing school so that you can consolidate studying and focus on what you really need to know. If you want to learn more about nursing.com, check out my affiliate link below. During family therapy, the nurse notes that one of the parents seems to be taking advantage of a child in the family and manipulates her into taking sides. This pattern of behavior is best defined as which of the following: triangulation, scapegoating, distracting, or socializing. The best answer here is triangulation. Triangulation is an unhealthy pattern of relating between people that occurs when a third person, at times a child, is drawn into a conflict. By doing this, the third person may take sides with one of the members who is experiencing conflict, resulting in an imbalance of power. Scapegoating refers to placing the blame on another to distract from the issue at hand. So, for example, if two couples are having marital problems, but instead of dealing with their own marital problems, they focus all of their attention on the problems that the child is having, or they're blaming the child for things in an effort to avoid dealing with their marital problems. That would be an example of scapegoating. You can pause to read the other rationales. Which best describes anhedonia? So anhedonia is lack of pleasure. The prefix a means without. It is used a lot in mental health or psych nursing. So for example, when someone is experiencing depression or even negative symptoms of schizophrenia, they may have anhedonia, avolition, no motivation, though a lot of the A words. Avolition is a lack of motivation. The best answer here is an inability to take pleasure in any activity. If you've ever heard of the term hedonistic society, that is a society that is pursuing only pleasure. So A is without pleasure. Many people are able to experience pleasure whether through experience or relationships. A person with anhedonia has a reduced ability to find pleasure in anything. This is a core feature in major depressive disorder. You can pause to read the other rationales. You are caring for a patient with a disturbance in self-concept. Which of the following nursing diagnoses should you consider when planning care? Select all that apply. Disturbance in self-concept. So not skin integrity. High risk factors associated with poor self-concept include developmental changes, trauma, biological sex dissonance, cultural dissonance, loss of body part, disfigurement, unhealthy relationship, sense of failure, change in role and powerlessness. A disturbed body image leads to a high risk for altered self-concept. The nurse is helping an elderly client maintain psychosocial health. Which of the following are appropriate ways to do this? Select all that apply. We don't want to discourage self-care. We don't want to encourage financial dependence on relatives. In order to maintain psychosocial health in an older adult, the nurse needs to assess for abnormal responses to the aging process. Some clients respond in an unhealthy way to the aging process, and if the nurse notes this, interventions can be employed to help the client adjust. The older adult should be encouraged to utilize family and friends rather than refrain from asking for help. If the client or a family member is in need of therapy, information can be provided while under the care of the nurse. A client is struggling in caring for her aging mother in her home. The nurse has given her a diagnosis of caregiver role strain. Which nursing intervention would most likely help this client to adapt to her reversed role? Help the client identify areas of support in her life. A person may experience caregiver role strain when the toll of caring for someone else leads to negative consequences for the caregiver. The caregiver may lack this proper support to be able to adequately care for another person and simultaneously take care of themselves. The nurse can help this caregiver to identify sources of support in her life and encourage the caregiver to utilize them, and helping this patient realize that she's not alone and that she can delegate other things in her life and she can ask for help instead of taking everything on herself. Thank you so much for watching. Make sure that you hit that like button and you smash that subscribe button. I currently have a goal of hitting 30,000 subscribers. I've been at this for 3 years and still haven't reached it. So it would mean a lot if you subscribed, and keep in mind that it doesn't cost you anything to subscribe and you can always unsubscribe later. Until next time.